Bonjour à tous, bienvenue à cette conférence de presse. On a avec nous trois ministres aujourd'hui qui vont d'abord prendre la parole. Le ministre de la Sécurité publique, Marco Mendicino, le ministre des Transports, Omar Alghabra, et le ministre de la Santé, Jean-Yves Duclos. Ensuite, on a également l'administratrice en chef de la Santé publique, Theresa Tam, et le sous-administrateur en chef de la Santé publique, Njoo, qui sont là également pour répondre aux questions, aux besoins. Commençons, let's start off with the statements from the ministers.
Bonjour tout le monde. Good afternoon, everyone. Je tiens tout d'abord à reconnaître que nous sommes sur le territoire traditionnel du peuple algonquin Anishinaabe. Je suis très heureux d'être en votre compagnie aujourd'hui avec mes collègues, l'honorable Omar Alghabra, ministre des Transports, l'honorable Marco Mendicino, ministre de la Sécurité publique, la Dr Tam et le Dr Njoo qui se joignent à nous virtuellement. Thank you for being there today. There's been a lot in the news recently about COVID-19, and we want to provide an update to you Canadians on what we know about the situation and what we are doing to respond to it. Dr. Tam and Dr. Njoo will provide soon further remarks on the global epidemiological situation. But for now, let me focus on our response. I'll be speaking about three immediate measures that we are announcing and implementing today. Premièrement, nous ajoutons 3 pays à la liste des 7 pays dont nous avons parlé vendredi dernier, qui sont le Malawi, l'Égypte et le Nigeria. On se souvient que les ressortissants étrangers de ces 7 pays vendredi et maintenant de ces 10 pays aujourd'hui, ces ressortissants étrangers qui ont transité ou séjourné dans ces 10 pays ne peuvent pas entrer au Canada s'ils ont séjourné au cours des dernières 2 semaines. Et les Canadiens et les résidents permanents, ainsi que tous ceux qui ont le droit de revenir au pays, qui sont passés par ces 10 pays au cours des 2 dernières semaines, doivent, à leur arrivée au Canada, s'isoler, se faire tester à l'aéroport et attendre le résultat de leur test avant de sortir de leur isolement. Ça, c'est pour les Canadiens et les résidents vaccinés. Ceux qui ne sont pas vaccinés, évidemment, suivent les mesures déjà applicables à tous ces pays, à l'ensemble des pays, c'est-à-dire qu'ils doivent se faire tester au jour 1, faire une quarantaine de 14 jours et se faire tester une deuxième fois au jour 8. The second measure we are announcing today is that all air travelers coming from outside Canada, apart from the United States, will now need to be tested at the airport in which they are landing in Canada, whether they are vaccinated or unvaccinated. They will then need to isolate themselves until they get the result of their test. Obviously, those that come to Canada and are not vaccinated from anywhere in the world need to do a quarantine of 14 days, as it has always been the case, and do a test both on day 1 and on day 8. The third measure is, as we've prepared for a possible extension of that last measure to all travelers by land and by air coming from the United States, we will be working with provinces and territories to see how that could be done. We don't know if it would need to be done, or whether it could be done if the situation evolves and requires such a policy to be implemented. And on that, I will be having a meeting with all of my provincial and territorial colleagues in about 2 hours from now to share those measures and to see how we can prepare for other eventualities. J'aimerais terminer par une série de remarques additionnelles. La première, c'est que je demande et on demande au Comité canadien national sur l'immunité, sur l'immunisation, ce qu'on appelle le NACI en anglais, de fournir rapidement au gouvernement canadien des directives à jour sur l'utilité des doses de rappel. dans le contexte actuel du nouveau variant Omicron. So this call that we are making is to ask NACI to provide quick guidance on whether we should revise national standards, national attitudes and actions on the use of boosters across Canada in the context of the new Omicron variant. Now, let us also remind Canadians that those rules have always changed over the last 20 months and change and will continue to change as the situation evolves. So this is what we are doing today. It may well be that as we gain time, we find that the new variant is of less concern than what some experts might be fearing, but the situation might also evolve differently. So we're reminding Canadians that travel rules and border rules in particular can always change, and that involves both testing and quarantine measures, and we will be watching the situation, as all Canadians will do, over the next days and weeks. Je voudrais aussi rappeler aux Canadiens que nous avons aujourd'hui, le 30 novembre, la mise en place de la directive que tous les voyageurs aériens ou ferroviaires au Canada ou vers le Canada, tous ces voyageurs doivent être vaccinés, ce qui est une excellente mesure qui arrive tout à fait au point et au bon moment dans le contexte de ce nouveau variant. Remarque additionnelle, nous avons eu hier, les ministres de la Santé de tous les pays du G7, une rencontre extrêmement importante durant laquelle nous avons reconnu la grande utilité d'échanger des informations dans le contexte extrêmement changeant et plutôt incertain du nouveau variant Omicron. Nous avons convenu que nous allons continuer d'échanger à tous les jours des informations fiables et transparentes sur la situation à travers nos pays, mais aussi sur des renseignements que nous pourrions avoir sur d'autres pays. Et nous avons, entre nous, et je souhaite le dire publiquement, nous avons reconnu et nous avons applaudi la transparence dont a fait preuve l'Afrique du Sud au cours de la dernière semaine. C'est un niveau de transparence qui a été difficile pour l'Afrique du Sud et pour d'autres pays touchés davantage par le variant Omicron. But this level of transparency and collaboration is absolutely essential if we want to maintain the efficiency of our public health measures, including travel and border measures, but also maintain the ability to be confident that we are going to keep working internationally in a strong and collaborative manner. Finally, a reminder that what is most important, as Dr. Tam and Dr. Njoo will probably remind us in a moment, what is most important in the context of COVID-19 is the application of public health measures and vaccination for all Canadians. These are the measures that make a difference when it comes to the biggest source of COVID-19 challenges, which is community transmission. So we know it's difficult for all Canadians, but we know that all Canadians see that there is hope. There has always been hope as we successfully in Canada, compared to many other countries, go through the crisis in better ways, just both from the economic side, but also from the health side. I was reminded recently by PHAC officials that if Canadians and their governments had acted in the same manner as we saw in the United States, we would have seen in Canada 60,000 more people dying of COVID-19. So Canadians can be proud of the fact that we have worked together. We've been supporting each other, governments alike, and because of that, we will go through this level of uncertainty in the best possible manner. So with this, I will now turn to Minister Alghabra.
Merci, Jean-Yves. Hello, everyone. Bonjour à tous. As we've been saying from the start, the COVID-19 pandemic can change rapidly. And when it does, our government continues to take unprecedented action to protect the health and safety of all Canadians by introducing measures to prevent COVID-19 and new variants of the various from being introduced and spread in Canada. We already have implemented layers of protective measures at our borders, including vaccination requirements, pre-departure PCR testing, and mandatory random testing. Today, to confront the Omicron challenge, we are taking additional action to prevent further importation and spread. Canadians and permanent residents who have been to any of the 10 countries that Minister Duclos listed, even those who are fully vaccinated, must be tested before entering Canada. Starting tonight, these tests cannot have been administered in any of the countries the minister named. This means that Canadians will need to stop and obtain valid results in a third country before entering Canada. Upon entering Canada, these travelers with a right of entry will be tested again and required to wait in a designated quarantine facility until the result of their day one test result is known. If the test result is negative, vaccinated travelers can then follow their quarantine plan and isolate until they receive results of day 8 test. Unvaccinated travelers must remain in the designated quarantine facility for their entire quarantine period. These testing measures will allow us to assess the evolving situation and determine any additional and appropriate measures. Notre priorité est de protéger la santé des Canadiens. I've said it before, vaccination is one of our best tools to reduce the spread of COVID-19 and its variants. That's why we've put in place a mandatory vaccination requirement for travelers boarding planes and trains in Canada. And as of today, passengers flying on domestic, transborder, or international flights departing from Canada and passengers on Via Rail and the Rocky Mountaineer trains must be fully vaccinated to board with very few exceptions. À partir d'aujourd'hui, les voyageurs devront être vaccinés. Finally, I want to repeat what Minister Duclos said. I want to ask all Canadians to remain cautious and prudent. The pandemic is not over. To get vaccinated, to follow public health advice, and if they're thinking about traveling, to recognize that travel measures could change at any moment. Our government's top priority is protecting Canadians' health and safety, and our response to the COVID-19 pandemic is guided by the latest science and research. Thank you very much. Merci. And now I'll pass the mic to Minister Mendicino.
Bon après-midi, tout le monde. Thank you to Ministers Duclos and Alghabra for your updates. Keeping Canadians safe remains our absolute top priority. And as we continue to hear and learn of reports of the new variant of the virus, we have to double down on keeping ourselves and our loved ones safe. That includes following the latest public health measures and making sure we are as protected as possible by getting the vaccine. I want to thank all Canadians who continue to book their shots and receive them, including some adults now for a third dose, and many of our children under 12 who are now eligible. You're doing yourselves, your families, friends, and caring citizens a great service. With respect to Omicron and other variants of concern, we continue to take the strongest possible measures based on the latest scientific evidence and advice in concert with all of our partners. Last week, we quickly announced and implemented new measures at our borders and beyond in response to the Omicron variant, and we are making further precautionary adjustments again today as the situation evolves. As my colleagues have mentioned, those measures will work to slow down possible importations of the Omicron variant of concern. We are also working quickly with provinces and territories to determine how we could expand testing capacity to include all travelers from all countries, including the United States, from both land and air, if needed in the future. Canada's border service officers have been on the front line since the beginning of the pandemic, have done exemplary work in keeping Canadians safe, and I want to take a moment to thank all of them for their extraordinary and tireless work as we continue to manage the pandemic. They will continue to perform admirably and help ensure that these measures are followed. I would also like to remind all travelers, Canadians and foreign nationals who travel by land, air, or water for long or short trips to submit your health and travel information in the free ArriveCan app or website before arriving in Canada. It is mandatory. Foreign national travelers who don't submit their information through ArriveCan may be denied entry into Canada. Canadians who don't submit their information via ArriveCan won't be eligible for exemptions and may face additional delays at the border, and they may be subject to fines as well. I want to thank all travelers for their collaboration and patience as these new changes may increase delays at the border in the coming days and weeks. Our border service officers will never compromise the health and safety of Canadians for the sake of border wait times. We are all monitoring the public health situation in Canada and around the world together in real time, and we will continue to adapt health and border measures as needed. In closing, we say to everyone, get vaccinated. Follow the public health care measures which have been put in place. Continue to follow the measures that we have put in place at the border because they are there for your protection, your safety, and indeed the safety and protection of all Canadians. Thank you. Merci.
Merci beaucoup, Marco. Alors, je crois que pour gagner du temps, les deux docteurs ne souhaitent pas intervenir tout de suite, mais ils vont répondre à toute question que vous pourriez vouloir poser sur la situation épidémiologique, sur les enjeux plus techniques là, autour de l'impact possible du variant sur la transmissibilité, la virulence et l'effet, la protection que procurent les vaccins. Alors, on est prêt, je crois, là, à passer aux questions si vous le souhaitez.
Just a few rules of engagement. We have approximately 45 minutes for questions. We'll start off in the room, priority to questions in the room. And then if we have some time, we'll go to the phone lines. Je me rappelle une question suivie et on s'est entendu qu'on ne demande pas de traduction dans cette salle lors des conférences de presse. Alors allons-y, débutons avec Madeleine Blais-Morin de Radio-Canada.
Bonjour, Monsieur Duclos. J'aurais une question pour vous. Pouvez-vous nous résumer en quelques mots pourquoi ces 3 pays en particulier? Et est-ce que vous craignez qu'à ajouter comme ça des pays sur la liste d'interdiction de vol, des pays seraient portés à devenir moins transparents à l'avenir dans la communication de leurs données médicales? Je pense à l'Afrique du Sud, par exemple.
Très bien. Alors, merci pour l'excellente question. 2 choses. Donc, pourquoi ces pays et pourquoi la deuxième mesure autour là, des tests obligatoires lorsque les gens arrivent au pays. Alors, pourquoi ces pays? Parce que sur la base des informations que nous avons de Santé publique Canada, nous avons la chance d'avoir les experts ici avec nous aujourd'hui, il y a des craintes que justement, il y a un enjeu de transparence. Ce n'est pas une question de mauvaise foi, c'est surtout une question de capacité. Les 3 pays qui s'ajoutent aux 7 autres ont plus de difficultés à suivre ce qui se passe au sein de leurs frontières et que par conséquent, il est plus difficile d'utiliser les méthodes traditionnelles de protection des couches multiples pour pouvoir permettre à des gens qui ont séjourné dans ces pays d'entrer au Canada. Donc, ce n'est pas basé d'ailleurs sur la nationalité. C'est basé sur les séjours. Donc, un Français qui est allé en Égypte la semaine dernière, qui veut venir au Canada, bien, il est traité de la même manière qu'un autre, qu'un Nigérian ou qu'un Égyptien là, qui aurait séjourné à travers un des 10 pays identifiés dans la liste. Maintenant, sur l'enjeu de est-ce que ça donne des bons incitatifs, est-ce que ça permet aux pays de travailler ensemble? Bien, la réponse est qu'il faut effectivement faire autre chose pour encourager un niveau de collaboration internationale suffisant. Et on en parlait hier avec les pays du G7. nous avons convenu de travailler ensemble pour aider certains de ces pays qui ont envie d'être plus transparents, mais qui ont de la difficulté à le faire parce qu'ils n'ont pas les informations nécessaires pour le faire. Et on a aussi parlé de l'enjeu que non seulement maintenant on observe qu'il y a parfois et souvent des problèmes de quantité de doses, mais aussi des problèmes d'administration de ces doses. Il y a certains pays qui ont de la difficulté de plus en plus à administrer les doses qui sont disponibles. Donc, comment on peut travailler ensemble avec les pays du G7 pour envoyer des ressources peut-être un peu plus spécifiques en matière d'équipement ou de ressources humaines pour aider ces pays à administrer plus efficacement et plus rapidement les vaccins auxquels ils ont accès.
Est-ce qu'à court ou... Dr. Njoo, est-ce que vous vouliez réagir?
Oui, c'est Dr. Njoo. Peut-être je vais ajouter quelque chose de plus technique de la perspective de la santé publique. Comme le ministre Duclos a constaté, c'est vraiment une question d'épidémiologie. On voit maintenant dans quelques pays, peut-être les données probantes qui indiquent qu'il y a la transmission communautaire parce que c'est même les cas signalés au Canada, on voit que les voyageurs qui reviennent au Canada ont passé du temps en quelques pays où il y a maintenant des données probantes qui indiquent qu'il y a la transmission communautaire. Mais aussi, il faut remercier, je pense, que l'Afrique du Sud d'avoir la capacité de détecter et aussi signaler à tout le monde qu'est-ce qui se passe avec ce nouveau variant. Donc, je pense que avec les mesures maintenant à notre frontière, c'est vraiment pour gagner du temps, pour mieux comprendre ce virus. Il y a vraiment trois grandes questions concernant le variant préoccupant. Est-ce que c'est plus transmissible? Est-ce que ça donne peut-être les conséquences plus graves? Et aussi, est-ce qu'il y a un impact sur l'efficacité des vaccins? On n'a pas encore les réponses, mais les scientifiques à travers le monde ont travaillé étroitement avec une bonne collaboration pour trouver les réponses. Donc, pour l'instant, c'est ces mesures pour ralentir la propagation du virus. Et c'est pas comment, on peut pas, comment dire, fermer les frontières parce que le virus est déjà ici et aussi dans plusieurs pays. Donc, c'est quelque chose que une mesure pour gagner du temps, pour mieux comprendre le virus et pour préparer pour la prochaine étape, peut-être comment on va s'adapter, peut-être changer notre approche. Mais si je peux souligner aussi un autre point que le ministre Duclos a déjà constaté, on a des bons outils ici déjà au Canada. On a une bonne couverture vaccinale et ce qu'on voit à l'heure actuelle, le variant ou les souches prédominantes au Canada, c'est le souche le variant Delta. Et les vaccins sont très efficaces. Alors, c'est très important d'encourager encore l'adoption des vaccins. Et aussi, à part de ça, on a aussi des bonnes mesures bien éprouvées à l'échelle pour la protection individuelle, aussi à l'échelle de la population. Le port de masque, la distanciation physique, si c'est possible, peut-être limiter le rassemblement à l'intérieur parce que tout le monde commence à rentrer à l'intérieur avec l'arrivée de l'hiver. Aussi, la bonne ventilation, toutes les mesures comme ça, c'est très important à continuer à pratiquer, mais aussi, c'est toujours important pour toujours suivre les conseils des autorités de santé publique locale selon l'épidémiologie. Et c'est comme ça, dans l'ensemble, on va réagir contre le COVID-19 en général et aussi avec ce nouveau variant. Merci.
En suivi, M. Duclos, il y a l'OMS qui a lancé un appel au calme en demandant d'éviter les mesures brutales qui sont ni fondées ni efficaces. Est-ce que vous pensez que le Canada doit se sentir visé?
Mais je pense qu'il faut effectivement éviter de succomber à la panique. Je pense que les gens qui nous écoutent ont toutes les raisons du monde d'avoir confiance, entre autres parce qu'on fait les bonnes choses au Canada depuis le début de la pandémie. On peut toujours faire mieux, mais je pense qu'on a très bien fait et c'est un message surtout pour les Canadiens et les Canadiennes, on a très bien fait depuis le début de la pandémie, mais aussi parce qu'on travaille beaucoup avec nos partenaires étrangers. Bon, le Canada est dans une situation assez particulière où on a déjà des couches de protection solides là, depuis le début de la pandémie en matière de mesures frontalières. Mais dans ce cas-ci, la santé publique du Canada croit que ces couches additionnelles sont utiles dans le contexte de l'incertitude, comme le Dr. Njoo le disait, l'incertitude qui existe autour du variant là, Omicron.
Yeah, this first one's from Minister Alghabra. We're hearing a lot of reports, albeit anecdotal, about travelers flying currently who aren't being asked for their vaccine proof. They're going through all the necessary checks, but no one is actually asking for their proof. Are you comfortable with the rate at which airlines are enforcing this policy?
Thanks for the question. We've announced a vaccine mandate, a requirement of all travelers on planes and trains last August. We then campaigned on it in the last election, and when we formed government again, we announced that the creation of a two-phase approach for this mandate. Phase one was October 30th, and we granted some grace period for this month, including the allowance of PCR test as a substitute for not being vaccinated. And part of the grace period is given some time to operators and airlines to prepare their systems for checking of all proof of vaccination of all travelers. And what had happened between October 30th and today, we had system of random checks. As of today, all passengers will be checked for proof of vaccination.
And then, Minister Duclos, on the NACI, advice to NACI on the booster shots, are you looking at them to reevaluate their advice on booster shots or change it? Do you think we may need boosters earlier than perhaps they'd suggested?
That's right. We're asking for relatively quick advice, renewed advice on boosters. I know that we know that Canadians are asking increasingly about whether they should and whether and how that should be done, receive boosters. And that question is obviously of greater importance now with the new variant. So we are explicitly asking NACI to come up quickly with a revised view on where and how and to whom these boosters should be administered.
Hi there. My question is for Minister Duclos. Just recently, the CMA put out a report saying there have been thousands of excess deaths due to delayed surgeries and procedures because of COVID-19 complications in hospitals, and saying it would cost about $1.3 billion to address these backlogs by June. Are you looking at increasing the transfers to the provinces to try to best address these backlogs in the hardest hit areas?
Well, thank you. And our own estimate, which is, of course, dependent on the information that we receive from provinces and territories, is that there would be approximately 780,000 delayed surgeries in Canada at this particular time. Our understanding is that those delays are being reduced slowly because the pandemic is relatively under greater control now than it used to be, say, in a few weeks or a few months ago. This being said, there's a lot of work to do to protect the health of Canadians. Now, one more good news is that we've promised in the campaigns very significant and quick investments to address things like backlogs in surgeries, but also access to primary care, long-term care, home care, mental health care. So we have a total of $25 billion that we want to invest quickly in support to the priorities of provinces and territories. And we know that one of these priorities is exactly that, to handle the backlogs in surgeries.
And this morning we had the CEO of Moderna saying he's worried that the current vaccines may not be as effective against the Omicron variant as we've seen with past variants. With that in mind, can you give us an update on what you've heard latest from Health Canada on reviewing some of the antivirals from companies like Merck and Pfizer, just what the status is there, and has Canada begun purchasing any of these pills?
Well, on the last question, I can tell you that we have very strong and very good procurement contracts with, seven, as you might remember, seven companies, four of which we already have the ability to administer doses from. So it's a portfolio that from the start we knew was going to be very strong, and it did show that we had made, not we as politicians, but experts, made the right choice. And we have 420 million doses on order and therefore sufficiently so to give Canadians the vaccine that they need. Now, on your first question, I would prefer to turn to Dr. Njoo because it's an issue which Dr. Njoo knows more about.
Yes, I think if you're referring to the question of therapeutics, definitely, I think we all know the old saying that, an ounce of prevention is worth a pound of cure. And so certainly, as Minister Duclos has said, we've done well with our vaccines in terms of both our procurement and obviously the rollout across the provinces and territories. But we always know that, a certain proportion of the population will be unvaccinated due to, a number of circumstances. And even in those who are vaccinated, we're seeing some breakthrough infections. And so it's always important to look at what's out there in terms of therapeutics, in terms of treating those who do become infected. At the present time, we have quite a number of what we call therapeutics, monoclonal antibodies, and so on, that are being used more in the hospital setting to treat severe cases of illness, from COVID-19. And they're being used, obviously, by the specialists and in sort of certain circumstances. But what's very promising on the horizon is the fact that there are a number of what we call oral sort of therapeutics, which could be taken sort of out of the hospital setting, which doesn't require the same kind of, expertise because of intravenous administration and so on. So things are looking well. The government of Canada is in sort of advanced stages of discussions with, at this point, the two companies, Merck and Pfizer, in terms of what we call advanced purchase agreements. But obviously, at the same time, for Merck, I understand there's a rolling submission that's still sort of being looked at by Health Canada, and we anticipate a similar submission from Pfizer, in the coming days and or weeks. So that's what's going on, and obviously Health Canada will do what they need to do in looking at the clinical trial data to look at the efficacy results from the trials, and then obviously make a regulatory decision, and obviously look at the indications based on the data they receive. What we're also doing, though, then, is that we're looking at having consultations both with, I would say, the clinical experts across Canada, but also with the public health experts in terms of should these therapeutics become available, how would they best be used in sort of in a practical setting in terms of implementation. So all I can say is at this point, things are looking promising in both sort of the regulatory process, but also in terms of the planning and thinking about how these types of therapeutics could be best used in the provinces and territories once they become available. Thank you.
Hi, David Thurton, CBC News. Thanks for taking our questions. Can you just clarify for me, when do these measures, particularly testing, when does that kick into place, or into gear here? If I heard you correctly, it's today. If so, what time today will travelers arriving into Canada have to do the testing? And what impact does this have on people who are coming from the US, either transiting through? Because, of course, that has been a backdoor for people to come into the country too, and there have been concerns about testing at that border too.
I'll try to answer the three questions, although some of these would be more in the domain of my colleagues. First, on the matter that Minister Alghabra mentioned when he spoke about when the requirement for people coming to Canada, having spent time in the last 14 days in those 10 countries, the requirement for those people to be tested at their last country, before entering into Canada, that was going to take effect tonight. Now, the second thing about orders in council or orders is about the inclusion of the 3 new countries in the set of 10 for those for banning any foreign national having traveled through these 10 countries in the last 14 days, and asking all Canadians that have traveled in these places in the last 14 days to be tested and to wait for their test result. So that those requirements will be put into an order in council, which will most likely apply tomorrow. So. In a few hours from now. And for the testing procedures, testing vaccinated and unvaccinated air travelers entering into Canada, that will be done as quickly and as much as possible over the next few days. Now, obviously, no, that can't take place immediately everywhere at the same speed, but we have full confidence in the system, and in particular in our collaboration with provinces and territories, because some of these testing procedures, testing events, and then the follow-up with quarantine, some of that and sometimes much of that require the collaboration, the participation of provinces and territories. But we believe and we have full confidence that this is going to unroll quickly over the next few days.
So I just want to follow up on that. So how soon, or what is the latest that we could see this implementation of testing? And it's only at airports, from what I understand. And will travelers have to pay for this test, or will the government pay for it?
Well, let me give you a number. We are currently, across the entire set of entry points in Canada, both through land and through air, we're currently delivering about 20,000 tests per day. And we need to move to about 32,000 tests per day to be able to do what we already do, including randomly testing those that come through the land border. But let's remember that land travelers are either they are tested necessarily if they come unvaccinated, or they are tested randomly, about a quarter of them if they travel to Canada at this particular time. So we'll move from 20,000 to about 32,000, which is a significant increase, and that's why it's going to take a little while for that to happen.
Just, I'm sorry, Chris, I know you were next, but your outlet got a question, so we're going to get other outlets who didn't ask a question to ask questions.
CTV. I was the only one in line, CTV, so CTV
let's go CTV, then the Devoir, and then the phone lines.
He came up after me, so.
And the ministers have a hard stop at 5:08, so CTV.
Discuss later.
Hi, Jordan Gowling, CTV News. My first question is your government considering a blanket travel ban, as Israel has done? I mean, is really this piecemeal approach of banning certain countries really going to be effective, given that this variant is now in Britain, Netherlands, and elsewhere?
Well, the first thing I want to say in response to that question is that the government will never hesitate to put in place the protections that are necessary to protect Canadians from the virus. That includes putting in place the travel restrictions, including those who are transiting through the listed countries, 3 of which we are adding to today. It includes making sure that we have the necessary testing regime. It includes making sure that we have as a baseline of protection vaccinations, which is the first and best line of defense against the virus. So we have never hesitated to follow the advice that we're getting from our public health care officials, which we continue to receive in real time, particularly with the advent of this variant of concern. And we believe that that the measures that we have in place are appropriate. We know that the Canadians are going to watch this very closely, as are we, and we'll take whatever decisions are necessary.
And just to go back to NACI recommendations on boosters, Minister Duclos, can you give us a specific timeline on that? And should provinces even be waiting around for these recommendations, given that the U.S. and the CDC have acted very quickly on moving that out?
Okay. Well, there are 2 reasons to ask NACI to do this quickly. By the way, this is an independent committee, and we're not going to force any experts to provide advice which they find is too early for them to provide. So the 2 reasons are, A, that there is a growing interest among Canadians from different provinces and territories in this particular issue. Christmas is coming. Many Canadians have been vaccinated now by close to 6 months, in some cases more than 6 months, and they hear that outside of the country, and some of them that you've quoted, the use of boosters has been more widely available. So they are curious, and they would like to know from the federal government what the federal experts think about the use of boosters overall across Canada. The second reason is obviously the advent of this variant, which is a source of concern, not a source of panic, a source of concern. And in that context, NACI may want to consider a precaution within the current environment as one more reason to renew and revise its advice.
Thank you.
Bonjour Boris, pour Le Devoir, je voulais savoir, c'était pas très clair peut-être pour les voyageurs canadiens. Je comprends que pour tous ceux qui reviennent par la voie aérienne, il y aura un test à l'arrivée à l'aéroport, sauf ceux qui viennent des États-Unis. J'aimerais savoir qu'est-ce qui arrive avec la quarantaine. Il y a eu un temps où on avait une quarantaine dans un lieu sécurisé, une quarantaine de 14 jours à la maison. Est-ce qu'il n'y aura rien de ça? Juste un peu expliquer ce dont les voyageurs canadiens peuvent s'attendre.
OK. Donc, c'est 2 plus 2. Alors, les deux, c'est États-Unis et non-États-Unis. Alors, les mesures d'aujourd'hui concernent les voyageurs qui viennent d'un autre endroit que les États-Unis. L'autre 2, c'est vaccinés et non vaccinés. Alors, les mesures pour ceux qui ne sont pas vaccinés ne changent pas. Elles sont toujours appliquées depuis de très nombreux mois. Ces gens qui arrivent au Canada, que ce soit par voie aérienne ou la voie terrestre, doivent se faire tester à l'entrée au pays, doivent s'isoler pour une quarantaine de 14 jours et se faire tester une deuxième fois au jour 8, mais continuer leur quarantaine jusqu'à la fin des 14 jours. Donc ça, c'est le 2 plus 2. Maintenant, ce qui change aujourd'hui, c'est pour les voyageurs vaccinés qui arrivent dans les aéroports canadiens d'autres pays que les États-Unis. Ces voyageurs vaccinés qui, présentement, n'ont pas toujours besoin de faire un test et n'ont pas besoin de s'isoler, même s'ils font un test, vont devoir faire un test et s'isoler le temps que ça prend pour recevoir le résultat de leur test.
Boris, question suivie.
In English, if you want to. Okay, so it's try to be equally logical. So it's 2 plus 2. So you've got the United States and the rest of the world. So what we're focusing on today is measures for people coming from the rest of the world, including the United States. Now, the other 2 is vaccinated, unvaccinated. The rules around those that are not vaccinated are not changing today. No, it's the same rules apply. When someone comes into Canada with a right of entry, that person needs to be tested at the land or at the airport. And that person needs to quarantine for 14 days and need to be tested once more on day 8. What changes today is the rule for those that are vaccinated coming into an airport in Canada. Those people will need to be tested on arrival at the airport and isolate and wait until their test result is known before exiting their isolation period.
Merci. Ma question de suivi sont pour les docteurs de la santé publique. J'aimerais savoir combien de cas du variant Omicron sont répertoriés au Canada en date de maintenant et si les mesures annoncées par le gouvernement du Canada vous satisfont ou si vous auriez aimé quelque chose de plus. Est-ce que vous êtes rassuré, autrement dit, par rapport à l'entrée du variant Omicron, par rapport à ce qui est annoncé?
Bonjour, c'est Dr. Njoo. Peut-être je peux commencer et peut-être Dr. Tam peut aussi ajouter. À date, on a 4 cas signalés de la province de l'Ontario et aussi un premier cas au Québec. Et honnêtement, je ne sais pas avec la différence avec le temps avec Alberta, mais je pense que Alberta est en train de peut-être confirmer, vérifier aussi un cas. Donc, si je peux compter, c'est comme peut-être 6, peut-être jusqu'à 6 à date, mais on attend peut-être des autres cas au Canada parce qu'on sait maintenant avec notre bon système de surveillance aussi, nos laboratoires est bien équipés pour faire les séquençages et tout le travail nécessaire pour identifier le variant Omicron. Donc, ça, c'est une chose. Et pour la deuxième question, si je comprends bien, Dr. Tam et moi et les autres, on fournit toujours nos recommandations. Qu'est-ce que les données probantes nous fournissent comme l'information. Et avec l'information, Dr. Tam, moi et les autres, tous les experts scientifiques, santé publique, on donne nos recommandations, mais aussi nos options aux décideurs, aux ministres. Et c'est sûr, c'est confidentiel. Il y a toujours plusieurs options. Et en fin de compte, c'est vraiment les ministres qui décident finalement c'est quoi les mesures ou des décisions à prendre. Donc, c'est ça ce que je peux vous dire. Et pour l'instant, comme j'ai déjà constaté, on voit que les mesures à notre frontière, oui, c'est une mesure pour l'instant, je pense que pour ralentir un peu la propagation, pour gagner du temps, pour mieux comprendre le virus, c'est aussi les grandes questions, les trois grandes questions, toujours concernant les variants préoccupants. Et donc, on va s'adapter au fur et à mesure comme c'est nécessaire. Merci.
I just need a clarification.
Non, on va passer aux lignes téléphoniques, Chris.
On quarantine, okay? So just because
Chris,
I'm an
il y a
English
des
network,
règles à suivre.
I'm an English network, I need the clarification on quarantine. So are people going to have to quarantine in quarantine hotels? Are they going to have to quarantine in their homes without other family members because we're getting into Christmas, the holidays? We're looking for clarity about the quarantine for the unvaxxed and vaccination. And that's just my question. I need that clarity, please.
Good, and I'll try to be clear. So what is called the designated quarantine facility, that's going to be used only for two types of travelers, those that come into Canada without a safe place to quarantine, and those that come to Canada from the 10 countries that we have signaled. The other travelers, in particular those that are vaccinated, Canadians that are vaccinated returning to Canada, don't need to go to a designated quarantine facility to wait for their day one test result.
Bon, alors, puisqu'on peut maintenant passer aux lignes téléphoniques, il nous reste à peu près 10 minutes. Donc, on va commencer avec une première question. Gardez ça court, les questions et les réponses, s'il vous plaît. Opératrice ou opérateur?
Thank you, merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. The first question is from Tonda McCharles from the Toronto Star. Please go ahead.
Yes, hi. Minister Duclos, I wonder if you could just clarify the testing requirement for air travelers arriving from non-U.S. countries. Do those people still have to do the 72-hour pre-departure PCR test in addition to the on-arrival test? And for the on-arrival test on day one, who pays for that, and what is the cost of a test like that?
The answer is yes to your first question. They need to do a pre-departure test before arriving to Canada, and they need to do a day one test if they are vaccinated. If they're not vaccinated, as I said earlier, a day one test, a day 8 test, and a 14-day quarantine. Now, who pays for the arrival test? That's the federal government. It's always been like that, and it will continue to be so.
And can you speak to your thinking around why you've chosen to add 3 more countries and I think you addressed some of this in French, but when it's clear today that this variant has popped up in many other countries, Australia, Hong Kong, Belgium, well, you're banning Egypt because a traveler came through Egypt, but in Belgium, it's shown up there, right? So I'd like to understand why you feel that a more general travel suspension isn't in order.
For 2 reasons. The first one is that community transmission in the 10 countries, as Dr. Njoo said earlier, is of concern, not only to Canada, but to our international partners. We were discussing that yesterday with the G7 health ministers. Now, the second reason, to explain part of your questions, is that we have double layers, well, in fact, triple layers. Because when someone travels, say, from a particular country to the UK before boarding to come to Canada, that person will first be subjected to UK rules for traveling, and then they will ask to show a pre-departure test in, say, London before boarding on a Canadian plane, and then when they arrive in Canada, they have another test, a day one test, to make sure that they don't have the vaccine and the variant. So that's because both of the strictness of our border measures, which is a level of strength that you rarely see in other countries. So we compare very favorably from the start of the crisis with all comparable countries when it comes to protecting the health and safety of Canadians because of our border measures. So it's because of that. It's also because of our geographical location. Now we have only one land border, and everyone else needs to enter by an airport. So because of that, we have this ability, this unique ability to have multiple layers of protection, which is sometimes more difficult for other countries.
Prochaine question au téléphone.
Thank you, merci. The next question is from Christy Kirkconnell from the Globe and Mail. Please go ahead.
Hi, good afternoon. If there's any concern that perhaps Canada could end up on a travel ban list of another country, given the fact that we already have a number of confirmed cases here, and there are investigations underway for several other cases.
Well, the good news about having a good system, as we have in Canada, is that we can identify the cases. So it's perhaps a bit strange to say so, but when we detect and communicate the presence of cases in Canada, that's good, because it just says that our public health system works. And the fact that we were able to identify those cases of travelers not long after they have landed into Canada, that's a great testimony to the fact that our public health system, both at the federal and provincial levels, work as they should. Nothing is never perfect. As Dr. Tam might want to say in a moment, there will be most likely community transmission of the new variant at some point in Canada. We see no evidence of this now because, as I said, we have been able to detect the cases of those travelers because of our border and other public health measures. Dr. Tam, would you want to add to that?
Yes, thank you for that question. And maybe just also partly answer what Tonda McCharles had asked before as well. So we use different criteria for flagging countries of concern. So the 3 additional countries that we're adding today, they have not yet reported Omicron variant in their own country prior to other countries reporting importations from those countries. So including Belgium, Israel, Hong Kong, South Korea, and now Canada, who've detected cases before the country of origin has detected cases. And this tells us that there may be some uncertainty in the country's overall epidemiologic situation and their ability to detect and respond. These countries also have very low vaccine coverage. And as I've said, exported cases, and they have not yet reported themselves. Another parameter we've looked at is our positivity rate on arrival in Canada. So we have this post-arrival testing, and from that, we could detect that there's been a rise in positivity rate, for example, from Egypt and from Nigeria. And indeed, we now have confirmed Omicron cases. All of our cases reported so far have been from Nigeria. And then the volume of travelers into Canada. So these are the several criteria that we use to pay particular attention to certain countries.
A follow-up?
Yes, thank you. I'm wondering, how is it ethical to be talking today about potential booster shots for healthy Canadians, given the fact that experts are decrying so-called inoculation hoarding by Western countries?
I may take this question. Well, we know that this pandemic is going to end only when it ends globally. And that's why we must obviously look after the health and safety of Canadians, but we also must be supporting other countries, especially those that are less developed and have certainly a public health system that is less developed. And this, and I believe Dr. Tam has been very active and influential in explaining why and how we need to do this. This is what we've done ever since we started the pandemic. So we are among any other comparable country, among the world leaders when it comes to supporting the distribution of vaccine doses through COVAX, to which we are one of the top contributors. We have also signaled, the Prime Minister has also said that we will be distributing 200 million doses over the next year. Many of these doses have already started to be sent. But we also have an additional channel through which we want to help those mostly developing countries through direct assistance for them to have the technology and the human resources necessary to actually administer those doses in an efficient and equitable manner within their country. So I recognize, and we all recognize, that this is a double challenge, but I think Canada is quite good compared certainly to many other countries in addressing that dual challenge.
Merci beaucoup. On a temps pour une dernière question au téléphone, opérateur.
The next question is from Laura Osman from the Canadian Press. Please go ahead.
Thank you. I just wanted to build on Christy's question because the WHO has specifically asked countries not to vaccinate healthy adults, not to give them boosters when high-risk people in countries with much lower vaccine coverage are still struggling. What is your response to that? How do we justify that?
Well, as I just tried to explain, we are doing this now. Now we started that many months ago, sending doses either through COVAX, either in kind doses or through financial arrangements with COVAX, or either through bilateral arrangements directly with some of the countries. And we have increased our development assistance significantly because of COVID-19 in order to provide the human resource and technological resources that countries around the world need and expect to be able to do their vaccine administration.
Thank you. I also wanted to ask, because obviously Omicron is already in Canada, you're going to be speaking with the provinces and territories this evening. Do you think there will be any discussion of domestic measures to try to quash the spread of this new variant?
I'm sure there will be, because we are all working for the same people and for the same objectives of protecting their health and safety. And as we know now public health measures and vaccination are the key measures to protecting our health and safety.
Merci beaucoup. C'est ce qui met fin à cette conférence de presse. Merci, messieurs les ministres.
Merci.